So what is early rehabilitation? Well, there's no globally agreed definition at the moment. So as we got together as a group to discuss it, we talked about it in terms of three main issues. So the first is about setting. Typically, this is rehabilitation that would start in an inpatient setting, although we know in a disaster or conflict setting that might not be the case, as patients are discharged very, very quickly. The second is about acuity. So often this is with patients who are still medically unstable or unwell. But again, in this setting, it might be delayed, and so it might start slightly later than that. And then the third is about timeliness. So ideally, this is about rehabilitation that starts as soon as possible from a patient's admission to a facility or the onset of their injury. But again, unfortunately, what we can't do is put an exact time on it, because we know in conflict and disaster settings, the timing of rehabilitation can sometimes be delayed. So why did we think it was important to talk about early rehabilitation as a specific thing? And I think that the reality, unfortunately, at the moment is that rehabilitation in disasters and in conflicts is often an afterthought. People assume that it's something that can start after the event, and that they don't consider when they're thinking about disaster management planning or conflict response. So what we're trying to do by defining it in this way is to emphasize that this is something that starts at the same time as all other medical care starts in emergencies. So early rehabilitation is simply the first phase of the overall rehab continuum, and it has two clearly defined features. So one is that it's about getting in there early to reduce or prevent complications, and the second is that it's about starting the patient on their journey towards the best possible recovery.